So I understand that all doctors here are preparing for January 2026 exam. So best wishes for you all, and thanks much for accepting this invitation to attend the meeting today. So we'll start about how the exam will be and how we can prepare for this exam. All of you you finished part one MRCOG exam. And I don't think it was a difficult one. Yes, always part one is considered the easiest step, let's say, and part two is the most challenging. So believe me, don't take part one as a rule that this is the level of the difficulty in MRG exams. No, part one is easy. We agree upon this. Part two is the most challenging because in part two, you need to collect all information, all data, all knowledge in gynae and OPS and related things. Okay, so you have to study so you can be an expert. Because once you finish part two, you are ready now for part three. And part three is not difficult. It's training about specific skills like communication skills, how to be safe doctor, and so on, based upon the knowledge you had in part two. So if you study well part two and you pass part two with good knowledge, believe me, part three will be easy. Just you will need to be trained to use some skills. So don't take it lightly, take it serious. Okay, and I don't say that all doctors who passed the part two were very, very, very clever. No, some passed with some luck plus some studying, but they will face a problem in part three. Okay, we say always that part three exam is not a knowledge exam. It's not a knowledge test. And this is right, because we are assuming that you finished the part two with good expertise in the knowledge. So if you pass part two without having enough knowledge, you have a problem now in part three. And you will need to study again part two to prepare for part three, which is not needed if you study well part two now. So please take it serious. The exam is after more than 6 months from now. The exam will be after 20th of January. So we have very good time from now. So are these 6 months enough? Yes, they are more than enough. But take it serious and start good studying from the beginning. So let's talk about some information about me. My name is OSAMA AKL, and I am a consultant to gynae and OPS and infertility. I worked in UK in this lovely hospital. It's called St. Mary Hospital. But now I am settled in Egypt. Okay, but actually this hospital, I got very good expertise from the hospital. I know very lovely people there, and I always remember the good moments and the good duration I spent there. It's a very lovely place with very good natural scenes. Okay, the best you can see. So now you are preparing for part two. You finished already part one. And as you know that MRCOG exam is a basic exam in UK for any trainee. So any trainee in UK cannot finish the training 7 years without having all parts of MRCOG, part one, part two, and also part three. You know that the training years in UK is made of 7 years of training. ST1, 2, 3, 4, 5, 6, and 7. To pass from ST2 to ST3, you should finish part 1 MRCOG. And to pass from ST5 to become ST6, you should finish part 2 and part 3. So actually, your level now is here. You are now at this step. So after finishing this exam, it's as if you are an ST5 and going now to be ST6. That's why in the exam, it's very important to solve the exam as if you are an ST5, not as an ST1 or 2, not as a consultant. You are an ST5. So you are not the most competent one in the department and you are not working alone. So this is your level here. The same information we say it if you are preparing for part 3. So solve in part 3 as if you are ST5 going to be ST6. So competent ST5. After finishing these 7 years of training, then you receive certificates of completion of training. So you are now preparing to be a consultant and start what's called advanced training of subspecialty module. So you can be a consultant in one of the subspecialties. So you are already now at this level, as if you are an ST5 and you want to upgrade to be ST6. Every one of these training years should always finish in 1 year. Okay, some doctors may not be able to finish. For example, 1 year can be not enough for an ST4. He can take longer. Maximum, he can add 1 year more to the 7 years of training. And in some specific special circumstances, a trainee can be given 2 extra years total all over the training. So this exam, it's studying, needs hard training, hard working. As I told you, in this studying for this exam, you are collecting information about everything in gynae and obs. Because actually, if a junior doctor is meeting somebody with MRCOG, he will think that he can ask any question he wants, and he is ready to prepare answers from you. Okay. And it will be difficult situations that you are somebody with membership of real college. Junior doctors are asking you, and you say, I don't know. I didn't study well. It's bad scenario. So we need hard studying. And don't walk in this way alone. This way is difficult. Okay, if you ask any gynecologist, what is the most difficult certificate somebody can get in gynae and obs all over the world, the answer will be MRCOG. Okay, that's why it's not strange that it's difficult. It must be difficult. If it was easy, it was not going to be with this importance. This certificate is very glorious. Okay, that's why it's not easy. So prepare well for it. And don't be alone. You have to be with other study partners. Okay, the same for part 2, the same for part 3. Okay, and believe me, the doctors you will study with in part 2 is the same group you will study with in part 3, inshallah, and all of you will attend the certificate receiving ceremony in London, inshallah, together. So the timetable for the coming exam, the exam will be 15th of January, and this is something good because July exams always at the beginning of the month. January exams in the second half of the month. That's why I believe that time is better for doctors going for January. Okay, but doctors going for July exam at the beginning of the month. So the duration is shorter. So it's good to start now to prepare for this exam. All of you should apply what's called expression of interest because expression of interest will close on 9th of September. What is expression of interest? It's very simple. This is the RCOG website. You will open the page of expression of interest for part 2. Here you will write your RCOG account number, and you can get it easily from your account. From your details, you can know what is your college ID. Here you will write your first name, and here you will write your last name and your email address. And you will press here, tick, tick, then submit. So it's very easy. And even if you are in doubt, am I going for January exam or not? No problem, do it. Okay, even if you are not sure if you are going for January exam or not, apply expression of interest. Apply it even today. It takes 1 minute. Because if you couldn't do it in the required time, which is before 9th of September, you cannot join January exam. So do it now. And already I have a QR code. You can screen it now and do it immediately on your mobile. Booking for exam starts 21st of October. And as I say always, you have to book for the exam in the first minute. First minute, not first minute, first moment. Okay, because as you know, the exam is done in person view centers, same like most of you had part one exam. That's why seats always are not enough. Some doctors may not find a seat for this exam. So you have to book for it in the first moment when booking starts. And the booking will remain to be open about 18 days. But as we said, we'll book in the first moment. And before the exam booking starts, inshallah, I will tell you some tips and tricks about how to book in the first moment. The exam itself, 15th of January, and about after 3 or 4 weeks, the result will be released. It takes about 3 to 4 weeks always. This is the amount of fees for this exam. Every one of you from part one exam, you know which band you are. Okay, that's why, for example, Egypt is band B. So this is the exam fees. Important notes. Okay, that some centers, like in India, they take extra fees for person view centers. Okay, other countries, mostly there is no extra fees. Okay, so you need to confirm if your country takes extra fees to the exam in addition to these fees, according to the country band. So this is a QR code. You can scan it now with your mobile and apply expression of interest now, even if you can. Okay, just you will need to write your college number, email address, first name, last name, tick, tick, and submit. So it's very easy. And you know how person view centers look like. Every doctor sitting in front of a PC, they open the exam module for you, you can solve. And part two exam, same like part one, it's made of 2 sessions. And but every session here is 3 hours, not 2 hours and a half, as in part one. So 2 sessions, everyone made of 3 hours. It's clear that exam is exhausting, too long. So 6 hours having the exam, 1 hour break in the middle. We are talking about 7 hours. It's long, yes. Exhausting, yes. So needs go training. So 2 sessions, session one, session two, everyone made of 3 hours, and in between there is 1 hour break. And every session or every paper is made of 100 questions, 50 single best answer, and 50 EMQs. Always, always, always EMQs are um, more difficult. Okay, because they contain many options. In every single best answer, we give you 5 options. Even if you don't know the answer, because there are 5 options, okay, there is 20% chance of luck to choose the right answer by luck. But in EMQs, for one question, I give you 25 options. So the rule of luck is 4%. And if 20 options, 5%, tricky. Yes, very tricky. In addition to this, EMQs are responsible for 60% of the exam marks. So it's not equal. EMQs, because they are more tricky, they have 60% of the pass mark, and single best answer 40%, usually. If you pass in EMQs in session 1 and session 2, mostly you passed in the exam. When they send you the result later, they tell you paper 1 single best answer, your score is, paper 2 EMQs, your score is, and you passed or failed, pass or fail, the same in session 2. Most of doctors, if you pass in EMQs, you are successful. Okay, because already they are responsible for 60% of the marks. And you don't need at all to say EMQs were more tough. Yes, we know from the first day that EMQs are more tough, and they are designed to be more tough. They are designed to reduce the chance of passing by luck. EMQs, they need deep studying, not superficial reading, because already we gave you 3 questions and the 25 options about a specific topic. So 3 different scenarios in incontinence, for example. If you don't know the difference between these scenarios, you will be confused which one to choose. And even I recommend that in the exam that you solve EMQs first, because they are exhausting to the mind. Okay, and they are already the cause of success or failure in the exam. So you can start with it at the beginning. So some information also about the regulations of the exam. How many times you can attempt part 2? The number is unlimited. No attempt limit. Unlimited. It's limited if you are a trainee in UK. So a trainee in UK, as you said, the trainee should pass part 2 and part 3 to be upgraded from ST5 to ST6. That's why if didn't pass within 6 attempts, so there is a problem. They will need to provide a cause why they failed and what circumstances making success difficult for them. But most of you are not trainees in UK. That's why the number of trials is unlimited. It's another evidence that this exam is tricky. Okay, that there is no specific number of trials. Okay, there are a specific number of years after passing part 2 that you should, after passing part 1, that you should join part 2 exam at least once so you can break this time limit. It's 10 years. And they even said that the years of COVID will not be counted. So actually, they are 12 years. So now you have 12 years time between part 1 and joining part 2 exam at least once. If somebody is near to cross this border, please contact me so we can count the years together to know if there is a problem or not. Because if you couldn't join part 2 exam at least once, even if it was not successful trial, but you join the exam, you break this time limit. Okay, so within 10 years, and they added later the 2 years of COVID, they are not counted. Okay, so year number 2020 and 2021 are not counted. So we can say overall they are 12 years. And don't wait to reach to this border. So join the exam as soon as possible. And don't say, I am not ready. If you wait until being ready enough, you will not join this test. Okay, start studying now. Take a decision now to go for this exam. We have already 6 months. It's a very good time to prepare well for part 2. For part 1, 3 or 4 months are enough. For part 3, 4 months are considered enough. I'm talking about hard studying. For part 2, 6 months is a very good time. And I teach part 2 courses since year 2016. So, inshallah, I'm about to finish 10 years of experience in teaching part 2, also part 1 and part 3. I teach part 3 since 5 years, and I teach part 1 also since about 8 or 9 years. But I started my courses with part 2 at the beginning because I finished part 2 in my first trial. So I was very passionate to start teaching immediately. Okay, and alhamdulillah, I helped hundreds of doctors to pass part 2 exam, many more also in part 1 and in part 3. So this was my first course. Okay, it was for exam July 2017. This was my first batch. Okay, and alhamdulillah, from the first course, from batch 1, always we have very good number of successful doctors. And many of them, alhamdulillah, later even became instructors for part 2, part 3, and part 1 exam. Uh, this batch, starting today, it's batch number 18. And this one was batch number 1. Okay, then batch number 2, 3, and so on. Okay, so let's talk about our coming course, which started today already, which is preparation for January 2026 exam. What is it made of? So this course is made of about 40 online meetings. The meetings are on Friday and Tuesday. Friday, we start at 8 a.m. UK time, which is 10 a.m. Cairo time. And on Tuesday, we start at 12 p.m. UK time, which is 2 p.m. Cairo local time. After finishing these 40 online meetings on Friday and Tuesday, after that, we start the crash course, which will be always in the last about 6 weeks before the exam to revise, to summarize, to solve many questions, okay, many recalls in this crash course. From today, all course members, they have access to the tutorials on our website, osamaakl.com. Okay, any one of them, they have an account, they can log in, then open batch 18. They will find the recordings. Actually, from day one, I gave you all the recordings we had in the previous batch. So if you want to study any topic that even I didn't explain yet, you can get its recording and its PowerPoint online from the previous batch. Okay, but today, for example, we will discuss antenatal care. After the meeting, I will upload the new video and remove the old one, and so on. Also, we will solve from my question book. I will show it to you now. And there are weekly exams. Every Friday, you have a test. Okay, in this test, I gave you some questions and I want your answers about the topics I explained in the last week. And this is how the question book looks like. It will be available in the bookstores within 2 weeks, inshallah. Okay, this is how its cover looks like. It's covering almost all topics present in our curriculum. MashaAllah, it contains more than 1,250 questions and answers, most up to date. Okay, so it's updated until yesterday. Okay, because we will start to make the bulk printing in a couple of days. So until yesterday, I send updates because always there are updates. Okay, covering most of topics in our curriculum, including single best answers, EMQs, and short answer question. And I believe short answer question, it's similar to EMQ, but without giving you options. Because in this short answer question, I am expecting to hear from you the exact answer, same like the guideline. If you give me a partial answer, you are wrong. I need complete answer, same like what the guideline said. So I believe it's similar to MQ without giving you options. That's why it gives us a chance that the book contains this very huge amount of number of questions, covering 62 chapters. And there is something unique also here, that there are video tutorials. So doctors who will get the book, they will find inside the cover, there is a code. And they have to send this code to us so we can add you to the folder containing the videos for solving all questions in the book. Okay, so it's a book as a hard copy. Also, there are videos for the question solving discussion. And even generic competences covered. What is generic competences? Many doctors who don't pass in the exam, they find that they failed because of an item called generic competences. The problem is that they don't know what is the meaning of generic competences. We have a chapter for it in this book, and we solved many questions about it in this book. Okay, if you can do scan to this code, or I can share with you now the video about this book from YouTube. In a moment, you will see again my screen. Hello and hi, I am Dr. OSAMA AKL, MRCOG. Thanks for scanning the QR code on the cover of my book. Part 2 MRCOG exam has always been the most challenging part to pass MRCOG and get membership of the Royal College. With 10 years of experience in teaching all parts for MRCOG and also my experience in working for NHS, I helped hundreds of candidates to pass these exams. Question solving is a very effective method in learning and preparing for such exams. It helps you to update your knowledge and improve it, and increases your chance of passing in these exams. This book is a very helpful source for doctors preparing for MRCOG Part 2 and other exams based upon UK guidelines. It covers 62 topics, which cover almost all of the green top and the NICE guidelines and many other resources important for this exam. The book covers more than 1,250 questions, which cover almost of the syllabus for the exam, and with different formats of questions including single best answers, MRCOGs, and also short answer questions. An innovative idea in this book is that you can have access to video recordings while we were solving all of these questions. To get access to these videos, there is already a unique code present inside the cover of the book. Please send this code with your Gmail address to our WhatsApp so we can give you a private access to these recordings online. Thank you, and best wishes for all candidates. The book will be available, inshallah, as we said, in bookstores and online also in a couple of weeks. And if you want more questions about it, please join my WhatsApp channel. I will send you the link. You can ask about it in private. Okay, that once it's available in the magazines, I will tell you so you can get it, inshallah. And already many doctors in batch 18 already they subscribed for a hard copy of the book. Even if you don't have hard copy, we will solve as many as possible. I will try to solve all of them during the course, inshallah. Okay, so how our website looks like and what is the timetable of the course. So this is the timetable of the course. This is a Excel sheet. Okay, so today is day 1, 8th of July. Today we will discuss, inshallah, antenatal care. Then we meet every Tuesday and Friday, every week, no breaks, until we finish the longer course in 18th of November. After 18th of November, we start immediately to start our crash course. In the crash course, I explain statistics. Again, summarize the most important few slides in every book. The same in gynae, the same for generic competences, and also question solving and recalls solving in the last 5 days. Okay, so it's a very useful crash course, and I believe it's the best thing you can do in the last few weeks before the exam is reading very well, studying very well the crash course. Okay, and the topics, let's read their name so you know what are the contents. Antenatal care, this will be today, diabetes, early pregnancy, maternal collapse, hypertension, RBC antibodies, fetal growth restriction, and it's divided on 2 days. Number one, we explain the definitions. Then number two, explain the topic because it's an important new guideline. Neurological disorders, surgical smoke, it's a talk article because talk articles are included. Cardiac diseases, already this is talk article, multiple talk articles. Amenorrhea, phenylketonuria, recurrent miscarriage, fetal growth restriction, second session. Breech presentation, ECV, breast cancer, preterm labor, cord prolapse, VTE, FGM, SLE, abortion, multiple pregnancy, asthma, appendicitis, TB, cesarean section, induction of labor, thalassemia, sickle cell, renal diseases, thyroid, reduced fetal kicks, inflammatory bowel, vomiting with pregnancy, GBS, liquor problems, obesity, thrombocytopenia, antepartum hemorrhage, postpartum, complex social factors, abdominal incisions, ACUM, which is accessory cavitary uterine malformation, pancreatitis, skin eruption, infections with pregnancy, psychological problems, intrapartum care. It's also divided on 2 days, gynae infections, vulval problems, contraception, laparoscopy, hysteroscopy, electrosurgery, ovarian cancer, cervical screening program, cancer cervix, sepsis, ovarian cyst, urogyne, endometriosis, BOP, which is pelvic organ prolapse, endometrial problems, hyperplasia, cancer, PMS, infertility, nerve injuries in gynae and OBS, menopause, androgens in menopause, teaching, precocious puberty, puberty. Um, heavy menstrual bleeding, many summaries for talk articles, hematological problems, hysterectomy, and IOPD. Because it was updated, the guideline was updated, so it was, although it's an obstetric topic, it was at the end of the course. Because always there are updates. And thanks for the college. Now they told us what are the guidelines which are undergoing updating. So later they will publish an update about it. So this is our curriculum, and other topics are added according to updates because I always add new talk articles also to the course. Condensed, huh? Many topics. Okay, but the good thing is that you will take the summary. Okay, I read and tell you what is the summary about this one, what important points, what may come in the exam. How our website looks like. This is the website link. All course members, they make an account. Then we add the material to their private account. Then they access through their profile. What is present on the website? You will find video recordings from the previous batch and videos of the new batch. So we update the videos. Also from day one, you have access to all PowerPoints of all of these topics. We said their names now. Okay, and also you have access for quizzes. Every topic has a quiz on the website. Every topic. You solve, you submit, you take a score, and we tell you what are the right answers. So you know what are your mistakes. We have quizzes covering 3,000 questions. Okay. Dr. Yasser, yes, you are right. Some doctors until now, they have only access to the PowerPoint because we gave it to you earlier. Okay, because doctors who join the new batch early, I gave them access to the PowerPoint until the new course starts. So from today, Dr. Yasser, please contact me or contact Mr. Mahmoud. You know him. So he can start adding to you the full library other than the PowerPoint library. Okay. So quizzes of 3,000 questions. This is in addition to the book. The book is not included in these quizzes. So now actually we have total more than 4,250 questions. 4250, very big number of questions. You don't need any other source to solve the questions other than our material. Okay, this is how the quizzes looks like. They give you a score and you know what are the right answers. Alhamdulillah, we have very good feedback from all candidates over the previous 17 batches. Okay, and these are some samples. Inshallah, as long as we started the course actually today. Okay, that's why tonight we'll confirm that all course members, they have access to the website. Today is meeting number 1. We are in the first hour, in the first meeting, in the batch. So tonight, inshallah, we'll confirm that all course members, they don't have any technical issues and they can access easily the material because you will study from today, inshallah. Okay, so any question about anything, whatever in the course or how to prepare for the exam, because after that we'll take a small break, 5 minutes. Then we start our scientific meeting, which is antenatal care in UK. Any questions? You may open your mic now. This is a soft copy of the book. This is first page. Then we talk about how the exam looks like after the introduction. And here is a table. So topic number 1, diabetes. There are 15 questions about diabetes, early pregnancy, 19 questions, maternal collapse, 7 questions, hypertension, 8 questions, RBCs, 13 questions, and so on. Okay. And the remaining of the topics, the remaining. Okay, so these are the questions present in the book. As we said, the number is more than 1,250. It was about 1,270 plus. Okay, for example, here diabetes. This is a MQ, options, and questions. The good thing that it's very easy to find the answer because already the table of the answers is present just after every module. For example, here, this is first page in diabetes, second page in diabetes, third page, fourth page, single best answers. After MQs, here are the answers. So you don't need to make a big search. Where are the answers for every module? You solve, then you find the answers. Other questions? This was diabetes, for example. Then next topic, early pregnancy. Okay, they are short answer questions. And I need the answer exactly like what the guideline said. If you give me any other answer, it's wrong. Because in MQs, we need the answer exactly same like what the guideline said. And in this pattern of questions, okay, here MQs and single best answer. Here are the answers of short answer question. Pregnancy unknown viability, question 1. Question 2, the answer is TVS after 1 week. If you say TVS without saying 1 week, it's wrong. I need it exactly, same like what the guideline said. Okay, less than 35 UBT after 3 weeks. Beta HCG weekly. If you say just beta HCG, it's wrong. If you say weekly also, it's wrong. I need weekly until it's negative. Okay, so I consider it like EMQ with unlimited number of options, without even give you any options. Other questions? What about book videos? There is a unique code, yes. It's present in the inner cover of the book. You will need to send this link to me. So we can add, we can give you the link. We can take your email address and give you the link where you can find the video recordings for every topic. They are already ordered and organized like the book. So you solve it early pregnancy, you can go and open early pregnancy. You will find the video discussions there. Okay. Okay. And already in the current course in batch 18, we will solve many, if not all of the questions in this book, inshallah. So again, doctors who attended with us previous course for part 2, of course, they have discounts. Also, there are discounts for groups. So if you have a group of doctors, you can contact me. You will receive special discount for you and a discount also for other colleagues. Okay, but if you are the group leader, your discount is higher because I consider that you are representing us. So you will receive higher discount than other colleagues. Okay, so this was everything about introduction of the course and introduction about MRCOG Part 2 exam in Jan 2026. Now we take a small break, 5 minutes. Then we start to speak about our first scientific topic, which is antenatal care in UK. It will be after 5 minutes. I will use the same link. I will not close this session. Just you will hear some music until we come back after the break, inshallah. See you after 5 minutes. Salam alaikum. Bye.